Hello, everybody. We're just waiting for everybody to hop on the training. We'll just give it another 30 seconds or so. I just wanted to let everybody know that the webinar is being recorded, and we will plan on sending out the webinar recording on Wednesday, so you do not have to take notes. But yeah, we'll just wait about 30 more seconds just to get everybody in, and then we'll get started. But welcome, everybody, and thank you for taking time to join the advocacy training tonight. Okay, good evening, everybody. We're going to go ahead and get started. Welcome to advocacy training for the NFED's Advocacy Day on Capitol Hill. I just quickly wanted to mention again, we'll be recording this. You don't have to take notes. The recording should go out on Wednesday if all goes well. But you know how things go, so if it doesn't go out on Wednesday, it'll go out as soon as possible. Jen says she cannot hear me. Kayla, can you hear me okay?
Yeah, I can hear you. Is everybody hearing all right?
Okay. Well, we're going to keep on going. So seems like it's working. So I just want to quickly introduce myself. Again, welcome. My name is Becky Abbott, and I'm the co-chair of the NFED Family Advocacy Committee, along with my other co-chair, Kevin Kocher, who is not on tonight. I'm also the NFED Director of Research and Special Assigned Projects. But most importantly, I'm a mom of three wonderful boys. I live in Slinger, Wisconsin, and my oldest son, Aiden, is affected by XLHED, which is a form of ectodermal dysplasia. I'm here tonight with my son, Ryder, who's
Hey,
here.
guys.
He's just wanted to say hi quick, who will be doing really quick youth advocacy training, and then also Lachlan, who will be representing Soapbox Consulting. So first and foremost, I just want to thank everybody for being here again. And Lachlan, if you would like to start and share information about Soapbox as well as the schedules, that would be fantastic.
Sure. My name is Lachlan Kerr. I'm with Soapbox Consulting. This is the third year working with you guys, so I recognize a lot of your names. Welcome back to DC. And for everyone new, I hope you enjoy your time here next week. So this is a map of where everyone is from. We have about 120 families from 31 states, and next week you will be conducting 135 meetings. Let's go to the next slide. So on Friday, you will receive by email a link to the Soapbox mobile tool. This mobile tool is not an app, it is just a website. You'll get an email, it'll have a very easy login. You can look at the mobile tool on your computer or on your phone, so that way you will have access to it next week. The Hill is a dynamic environment, so there will be changes to your schedule, and it's good to have something like the mobile tool because it will text you when there is a change to your schedule. I'll just go briefly into some of the features. When you first log on to the mobile tool, it will ask for your phone number. We ask that you put that in so that you get that text I mentioned. You'll see on the left hand of this screen, there are three green buttons. That's where you'll see your schedule. Next to that, you'll see your team. We've tried to team everybody up so no family is alone. Usually you're teamed with somebody from your state. There may be a couple teams that are across state lines. You'll see in the middle that's where you'll see your schedule. If you click on that button, it has information like the time of the meeting, the location, and then it would say the staffer you are meeting with. We do have some meetings with members of Congress, but many of them are taken by staff. So it's important to know who you're meeting with when you walk into that office. Once you have the mobile tool, this will make a little more sense, but there are buttons for feedback and a meeting roster. Those will also be of interest. You can provide feedback after each meeting, and in fact, we ask that one person who joins each meeting fills out that feedback form. You can also attach a photo. Every office likes to have a photo taken at the end of the meeting, so if you're interested in doing that, just ask the staffer. They will always be happy to do that. And let's go to the next slide, please. So this is the printed schedule you'll receive next week. You don't need to worry about this right now because it will become very clear when you receive it next Monday. It'll have all the same information as the mobile tool. I just want to mention that the mobile tool is always the most up-to-date form of your schedule. If you have any questions, we ask that you call the Soapbox Help Desk, which is another thing I would like to mention. If you, on the main screen, yes, and you can see the phone number in the chat, call that anytime in the next week during business hours, and we'll be able to help you out with any questions you might have. But also when you're on the Hill, that's the number you'll call if you're running late to a meeting, you have a question about your schedule, just any reason you need to call, we have 10 people there ready to answer. So let's go to the next slide. This shows the back of your schedule. It is a map of Capitol Hill. It shows all of the buildings that you'll be meeting in. So most meetings will not be held in the Capitol. They'll be held in the either House or Senate office buildings. The Senate buildings are to the north of the Capitol. There are 3 of them. They are connected underground. So if you're in one building, you do not need to go out and back in. The same is true on the House side, that they're connected. There are tunnels between the House and Senate side, but I want to mention that during the shutdown, you may not be able to get through them, so don't count on being able to get through there because you would need a staff escort at any time, but in the shutdown, there might be some different procedures. So I don't want anybody to expect you'll be able to go underground between those 2 places. You'll also see on this map, there are different entrances to the buildings marked and food, as well as estimated walking times. Regarding the shutdown and entrances, I have worked with several groups in the last couple weeks. They've all had great Hill days, but there are some intermittent closures of doors, and my advice to everyone is you will get into the buildings. The Capitol Police are around, and they will have the most up-to-date information on the day that you're on the Hill. But you will be able to get in. There just may be an additional step, like certain doors might be closed. Becky may have some more information on that later on the webinar today, and hopefully we'll have more clear information next week if anything changes. And let's go to the next slide. So here are a couple tips. So we ask that you will be meeting with staff. In many cases, you may be meeting with members of Congress. Remember that you're building relationships here. These are people you may need to interact with year after year. So remember, no threats, insults, or shaming. As I mentioned earlier, there's room in the mobile tool to submit a photo after your meeting. There's no video or audio recording, period. But a picture is always acceptable as long as you ask first. So finally, these meetings do have official rosters. When you receive your schedule by email this Friday, just take a look at it. If you have any questions or you think you might not be able to make a meeting because you're leaving DC, that's fine. Just respond to the email and we can work something out. When you're on the Hill, the worst thing you can do is not show up to a meeting that's been scheduled for you. So if you ever feel like that might happen, just you can either call the help desk if it's next week, or if you see the schedule emailed to you, just answer that and we can help you out. And with that, I will hand it back to Keith.
Thanks so much, Lachlan. We have a question in the chat that asks if the government shutdown is affecting Advocacy Day. And I'll just quickly talk about that. So the government shutdown has affected Advocacy Day in terms of the room rental that we usually had on the Senate side. There are no rooms that can be reserved during the government shutdown, as well as if you received the email yesterday, it did mention that the location for the dinner was changed. We were planning on having dinner on the Hill. We've also received word recently that some of the cafeteria locations are not open. Lachlan can talk about this more if you'd like to, but I believe the House side is closed, but the Senate side is still open. That could change. What hasn't changed are the legislative meetings. I believe as of today, we have about 75% of the meetings scheduled, which is incredibly amazing. I did see that there are several members of Congress who are scheduled to meet in person with our advocates, many of them that we have not met in person before, which is great. But one thing I'm going to ask of all of the advocates, and I know that this is hard to do, is just really provide us and all of the organizations who are partnering with us just a little grace. Everything is very fluid on the Hill right now, and things are changing very quickly. So we may have to provide you with an update saying that, we can't be dropped off at this location. We may have to move to a different location, or a member might not be able to meet with us and we'll have to meet with staff. But we really have been trying to keep up as much as possible with all the changes on the Hill. That just means that we may have to pivot and, shift a little bit on the day of, but hopefully all the legislative meetings will go smoothly. One thing I was going to mention is that there are a lot of repairs being done with elevators right now on the Hill. So you might have to wait at elevators a little bit longer or find an alternative location to get to another building. There could be door closures, as Lachlan mentioned, so you need to find an alternative route. But all of those things we just have no control over. So this Advocacy Day might look just a little bit different than previous Hill days. Lachlan, did you want to add anything to that at all?
No, that about sums it up. As I said earlier, I think the biggest thing is just be prepared for changes, and we'll communicate them to you when we find out. And if the Capitol Police are very helpful, I want to overemphasize that. If you have questions about doors, they are there to answer that. So, just walk up to them and ask your question about, hey, where do I get into this building? And they'll assist you.
Thank you so much. And then if anybody has any questions for Lachlan, please ask them now in the chat, and he can help you with those questions. Randy has a great question. If you have older kids or youth who would like to be able to download the web tool and access it, that is a great question. Yes, your older kids, especially there are some families who split up in between meetings, specifically if there's two meetings at the same time. Yes, we can send that information to Soapbox. Please email that information to me. Email your child's email address, and we will be able to add them to the web tool so that they can access those schedules. And then they can check the information just as you would, Randy. Is there anything that you would like to add to that, Lachlan?
No, we can always add another person from a family. It's very easy.
Does anybody else have any questions in regards to the legislative meeting schedules, how to access them? any changes that could occur before Lachlan hops off the call. Kayla, do you see any questions at all before Lachlan leaves?
Nope, not right now.
Well, thank you so much, Lachlan. I just wanted to say thank you to Soapbox and all of Lachlan's colleagues, if they're on as well. Soapbox does an amazing job. They're always very supportive, very helpful. If you have any questions, just know that they will be with us the night of November 3rd at our dinner. They'll be walking us through everything again, and they are always very, very helpful. So don't feel that any question is a stupid question. Truly bring any questions you have up to Lachlan, any concerns, and his and the staff there at Soapbox, and they will be more than happy to help you. So thank you again, Lachlan, and thank you for joining us tonight.
Yeah, thank you. I'll see all of you next week.
Thank you. So let's jump into everything else that we need to talk about tonight. I know that your time is very precious, so let's start talking about the Ensuring Lasting Smiles Act. So we have quite a few new advocates who will be joining us on the Hill this year. So I just really wanted to give a really brief overview of what ELSA is, what we need to talk about on the Hill, what our asks will be this year. And if anybody has any questions, enter them in the chat and I will get to them as we go through these slides. So of course, we all know we are going to be going to the Hill to talk about the Ensuring Lasting Smiles Act. ELSA, which is what everybody knows this bill name for, is federal legislation. It's based on the 50 state statutes that would require insurers to offer coverages for the medically necessary repair of congenital anomalies. And one of the most important parts of ELSA is that it allows the treating physician to determine medical necessity versus the insurance company. So about 4% of children are born with a congenital anomaly. And what will ELSA ultimately do? It would ensure that private, group, and individual health plans do not deny or delay medically necessary treatments of congenital anomalies. And some of those anomalies include oral defects such as cleft lip and palate, hypodontia, enamel hypoplasia, vision anomalies such as congenital cataracts or aphakia, and then also hearing anomalies such as hearing loss that is from microtia and atresia. It does cover other disease states as well as other anomalies. And if you have questions about that, you can always reach out to me afterwards. So who are our bill sponsors for the 119th Congress? So in the Senate, we have Senator Tammy Baldwin from Wisconsin. We have Senator Joni Ernst from Iowa. And then our last two bill leads in the House retired. So now we have two new bill leads for the 119th Congress, which is Representative Neil Dunn from Florida, as well as Representative Schreier from the state of Washington. Both of them are physicians. So we're excited to have our Senate bill leads back and also our new House leads. So what is the status of ELSA? As I'm sure many of you know, Congress restarts every 2 years. So on January 3rd of 2025, we started a new Congress, which is the 119th Congress. Our bill was reintroduced in May of this year. Currently, we have 29 Senate co-sponsors and 92 House co-sponsors. As we continue to gain more co-sponsors, the bill will then go through the legislative process. We don't know exactly which route it will take. As we learn more information, we'll be sure to share that with you. As it goes through the legislative process, the bill will then go for a vote, either in the House or the Senate. We don't know which one it will go to first. Last time in the 117th Congress, it went to the House for a floor vote. The picture that's here is actually the House vote from the 117th Congress. And as you see, it did pass in the 117th Congress with a supermajority vote. We had 310 yeses and 110 nays. So we're hoping that we can garner even more support this time. I think I've had quite a few people reach out to me recently and ask if we are close to the number of co-sponsors that we reached in the 117th Congress. In the 117th Congress, we we reached 61 Senate co-sponsors and 317 House co-sponsors. That doesn't mean we're behind. We're actually going at pretty much the same speed as we did in the 117th Congress. We just need to keep going at this rate and continuously trying to get more and more co-sponsors so that we can try to reach the supermajority number again. In order to move the vote, or after votes, of course, the president has to take action no later than January 3rd of 2027. Once the bill would be signed into law, then there would be a 1-year implementation period where insurance companies basically have a year to implement this bill into their insurance policies. So let's talk a little bit about what our asks are going to be when we're on Capitol Hill. There'll be 2 different asks, and I don't know why my slide has one, both, but you know what I was trying to say. The first one is going to be, please support and co-sponsor the bipartisan, bicameral Ensuring Lasting Smiles Act, or ELSA, in the 119th Congress. And that ask would be for anybody who has not co-sponsored yet. If your member of Congress has co-sponsored, it's just as important for you to talk with them and explain to them, now that you've co-sponsored, we need your continued support, and we need you to reach out to the bill leads to ask them to move ELSA forward. So the ask for anybody who has already co-sponsored would be, please reach out to the Ensuring Lasting Smiles Act or ELSA bill leads, indicate your continued support, and ask how you can help move ELSA through Congress. I'm just quickly looking at the questions. Okay, so I'll go through those in just a little bit. Here's the timeline of what you can expect on the day on the Hill, and just be aware, these could change at any time, and we will let you know ahead of time, either through texting or through the Soapbox app. So as of today, we will be meeting at the Hyatt Place in DC. If you're staying there, I think check-in starts at 3 p.m. on Monday, November 3rd. We're going to be taking a bus from the Hyatt Place to the Hamilton restaurant, where we will have dinner. Please make sure that you register as soon as you arrive at the Hamilton. Kayla and I will be setting up a table there with your bags, your packets, t-shirts, everything that you need for the event. And then you will need to find your state table and sit at that table. That's how we will pass out the packets. And then you will also be able to talk to the advocates in your group, so you know exactly who will go first, who's your lead for the meetings, and how the meeting should go. We're going to have a welcome session. Soapbox will be speaking and sharing the legislative schedules, the paper versions. We're hoping to have a few guest speakers. And then as soon as we're done, we will be getting back on the buses from the Hamilton, and we'll be bused to Capitol Hill. We'll be dropped off on the back portion of the Hill, where we'll walk to the Hill stairs. We'll raise awareness for ELSA. It's a great time to do quick videos, take pictures, post, try to get others to advocate for ELSA while we're on the Hill, and then garner extra support. When we're done with that walk to the Hill stairs, we will then jump back on the buses. The buses will be again in the back of the Capitol Hill building, where we'll go back to the hotel. And then we're going to have ice cream sundaes from Ben & Jerry's, and just really take a little bit of time to get to know one another and talk about, our worries, our excitement about the Hill. And I know that there's a lot of new advocates. So this is really a really good time for advocates and kids to talk with each other and share their experiences from the years in the past. So on Tuesday, we will wake up early for breakfast. I know it's early. I'm not a morning person, but we can do it for one day. We'll get up for breakfast. The hotel is providing breakfast. The Hyatt Place is providing breakfast. And then we will start boarding the bus at 7:15. Once we board, the buses will depart from the hotel, and they will go to the ADA townhouse. The townhouse has the ability to store luggage. So if you need to store luggage, if you'll be leaving directly from the Hill, you can leave your luggage there. Just know that the luggage has to be picked up by 5:30. It cannot stay any later than 5:30. We have to have it picked up, so just make sure that it's picked up and you are on your way by 5:30. Once we're dropped off at the ADA, you drop off your luggage if you need to. We will then walk over to the Senate side where our meetings will start. I think many of you actually have early meetings that start right at 9 a.m., as well as there's a couple of constituent coffees. So please, as soon as you drop off your luggage or you get dropped off at the ADA Townhouse, you'll be walking right in front of the Capitol building. You can stop, take a picture if you want, but please make it to the Senate side so that you have enough time to get through any security issues. And then the last legislative meetings are scheduled at 5 p.m., so we should be able to wrap up at 5:30. And just know that whenever you're done with your last meeting, that you're free to leave. We do not have busing back to the Hyatt, so you would either need to take an Uber back to the Hyatt place or to the airport or however you'll be leaving. Next slide, Gayla. So what to expect on Capitol Hill? First of all, there is going to be walking all day, especially for the new advocates. Many people think that they're going to the Capitol building and they'll be staying in that building. 99.9% of meetings happen outside of the Capitol building. There are 3 buildings on the House side and 3 buildings on the Senate side, and each of those buildings are on opposite sides of the Capitol building, so there will be a lot of walking. It usually takes about a whole 15 to 20 minutes to make it from the Senate to the House side and vice versa, and that does not include the time to get through security, depending on how long the lines are. So just make sure that you give yourself enough time to get in and out of each meeting. Also, if you are on the Senate side in the morning, feel free to ask Senate staff as soon as you walk into your last Senate meeting, if there is somebody who will be able to escort you by trolley to the House side. Just know that, again, the situation on the Hill is very fluid. They may not be able to do that for you. And they just might have enough, they might not have enough staff to escort you, but it is worth asking if you don't want to walk outside. Again, we'll be outside some of the time, so just if you burn easily or you don't like to be in the sun, bring sunscreen and hat if you are not using the tunnels, which again, we are unsure if the tunnels will be open that day, so just always try to think ahead. I'm just going to quickly mention the heightened security measures. There could be potentially long lines. The day we go back, the government might reopen and everybody could show up that day. So just be prepared if there are long lines. There could be protesters outside, which has happened in the past. Usually there aren't too many issues with that, but just know that certain doors could be closed. So we just really have to pivot and find another location to walk in. There are metal detectors and x-ray machines at all of the doors. If you are going outside, you have to go through security and metal detectors and x-rays every time. If you can use the tunnel system, you don't have to go through the metal detectors and x-rays each time, but just know that you cannot bring in large bags. You cannot bring in liquids or foods into the Capitol building if you have any meetings there. You can bring them into the Senate and House buildings, but just know that sometimes they do ask you to empty your water bottle beforehand, and then you can refill it as soon as you go through security. Strollers are allowed, and the NFED will provide tote bags that are allowed in the Capitol. So feel free to put all of your information packets in there, and you can bring those in with you. Next, Kayla. So here is a map of Capitol Hill. Right in the middle, you can see the Capitol building, and then on the upper part of the picture, you can see the 3, the Russell, Dirksen, and Hart Senate buildings, and then at the bottom, you can see the Rayburn, Longworth, and Cannon buildings, and then also there's a star in the bottom right-hand corner that says ADA Townhouse. That will kind of be our main base where you can visit throughout the day. You will have snacks and water available there. And then if you just want a place in between meetings to relax, you're more than welcome to stop there at any point. There are cafes again on the lower levels of the Senate and House. As of right now, the Senate side, cafeterias and cafes are open. We don't know if that'll be the case on Hill Day. What I would recommend is if they are open on the Hill Day, eating at the Senate after your last Senate meeting and then walking over to the House side. We're hoping that the House cafeterias will be open by the time we get there, but we don't know at this point. The U.S. Capitol Police are authorized to make exceptions on prohibited items only if they are required for childcare, medical, or other special needs. At each of those buildings, there are handicap accessible entrances. Those usually have very short lines. So if you have any health issues or can't stand in line for quite a while, then try to find one of those handicap accessible entrances, and you should have a shorter line to get in any of the buildings. So this is a list of the different Senate cafes that are available. I don't believe the Capitol Visitor Center or the cafe will be open unless the government shutdown ends by the time we're there. But these are the 4 different options you will have on the Senate side if they remain open. And then the House restaurants, there are several different options. However, as of right now, those are not open. So we will keep you updated if those open up. There are also health units in the Senate and House buildings that will be open. So if you have any issues or medical problems while you're there, feel free to reach out to any of the Capitol Hill staff or Capitol Hill Police, and they will be able to direct you to any of these health units. So I've had a lot of people reach out to me and ask, what can I be doing now before Hill Day? How can I prepare? And my number one answer is write your story, practice your story. And we have a ton of resources on our advocacy resource page. What I would recommend doing is write your story and make sure it's only 1 page. Basically, the rule of thumb is that any of the staff on Capitol Hill will not read more than 1 page. So you want to make sure that you have all the critical information in your 1-pager. Try to list your diagnosis, the daily impact and struggles of living with your congenital anomaly, what type of treatments you've received or will receive in the future, what are the costs or expected costs, what are the sacrifices that you've had to make to afford the treatments, or the sacrifices that you think that you will have to give up in order to afford treatments. Include pictures if you feel comfortable, and then also the legislative ask. Make sure you print out at least 8 copies of your story for leave behinds. I've had several advocates reach out and ask, can I bring extra copies in case I meet with extra offices or I see members of Congress in the halls? And it's absolutely a wonderful thing if you want to print off extra copies just in case, but I would just make sure that you have a minimum of 8 copies. I would prepare and practice a spoken version just to make sure you're at your 2-minute maximum. It really depends on how many people are in those meetings. You might have 5 to 10 minutes if there's only a couple people, but if those meetings are really packed, you may only get 2 minutes. So just practice just to make sure that it doesn't take you, for example, 8 to 10 minutes to share your story, because you just won't have time to finish. And we want to make sure everybody has enough time to share their story. So bring anything with you that you think will make an impact. I know there's providers and students on this call. Feel free to bring anything that you think would explain the medical necessity of treatments for your patients. You can bring dentures, you can bring pictures, you can bring receipts, anything that will make an impact and better explain to the members of Congress and their staff exactly why ELSA is necessary to be passed. Pack lightweight, comfortable clothes, shoes. I know there have been women in the past who have worn high heels. I truly would not suggest wearing them. It's a lot of walking. You're walking on marble and hard surfaces for usually 8 hours. But if that's what you'd like to do, you're more than welcome to. I just always like to mention, try to bring really comfortable shoes. You're more than welcome to wear pants, skirts, shorts. I know it'll probably be a little cool when we go there. And then you can wear your ELSA t-shirts, which will be provided by the NFED. I would encourage you to wear your ELSA t-shirts. It's a great way to raise awareness. When there's other advocates on the Hill, they always ask, what is ELSA? And it provides a great opportunity for you to explain. We've even had providers in the past from other organizations ask about it and then say, oh, I'm going to send an email right now to support your cause. I can't believe these type of treatments aren't being covered. And then also review your schedule and reach out with any questions. I'm available anytime up until, our legislative meeting. So reach out, Becky@nfed.org, and I'm happy to answer any questions or review your stories if you have questions. So let's talk about legislative meetings. Legislative meetings are going to last about 20 to 30 minutes, and it's going to depend on the number of advocates. Usually you have an average of 3 to 6 meetings per team. We usually try to do about 4 or 5 just to make sure that you have enough time to make it to your different legislative meetings. And again, advocates usually have about 2 to 4 minutes, but just to be on the safe side, have a 2-minute version of your story to share just in case you have quite a few advocates in your group. The number one tool in garnering support for ELSA are unique, powerful patient stories. It truly is the best way to garner support from members of Congress and their staff. Make sure that you speak from the heart, explain the medical impact of your congenital anomaly, and the insurance coverage struggles that you faced or you think you will face in the future. Use notes to share your story, and it's truly encouraged. I always bring notes just to make sure that I stay on task and I don't forget anything. You don't need to be an expert on ELSA, just focus on your story. Members of the ELSA and Advocacy Committee will reach out to these offices afterwards and answer their technical questions. So don't feel like you need to know every aspect or be an expert on ELSA. As a matter of fact, it's a great way to follow up with the offices afterwards. If there's something that you don't know, just say, I would love to be a resource and I'll share that information at a later date. Can I follow up with you? And then that gives you an opening to follow up with them afterwards. Please arrive 5 minutes early if possible. The team leader should facilitate the flow of the meeting to make sure that you stay on time. Set expectations. When you walk in, just say, we understand we have 20 minutes for this meeting. Do you still have 20 minutes? Prioritize the constituents. That means if I'm in a meeting with advocates from Illinois and we're meeting with Senator Duckworth, I would make sure that the Illinois advocates would go first because they're constituents. If I don't have enough time to share my story, I'll just quickly introduce myself and just ask the senator to co-sponsor. Focus on ELSA, don't discuss other legislation or political topics. And just for the newbies, just know that there are some offices who will bring up other legislation. They may bring up the government shutdown. And what I usually do is just really quickly try to shift the subject back to ELSA. Just say, that sounds, like some very interesting legislation, or I understand you're very upset about this. However, we're here today to discuss the Ensuring Lasting Smiles Act. Always try to stay positive. I know that some meetings get very emotional. There's sometimes that I cry as soon as I start talking about my son and everything he's going through. Know that that's okay. Don't feel bad if you start crying in meetings. It happens to me all the time. Make sure you take notes and take all the questions down and enter them in the mobile tool so we can follow up afterwards. Most of all, be kind. Most staff and members have a very busy day, and we want to make sure to stand out in the crowd. And even now, you have to realize that many of these staffers aren't getting paid. They have very long days. They're trying to navigate the government shutdown just the same as we are. They truly are meeting with us because they want to know exactly why their boss should support ELSA. So please make sure to be kind. Ask them how their day is going. Tell them that we appreciate them for, keeping Congress moving forward, even through the government shutdown, and that we truly appreciate them. And last but not least, relax, have fun, and stay positive. Even in a divided environment, try to stay as positive as possible. So let's talk a little bit about how to handle opposition. So first of all, take a deep breath. It'll be okay if you run into an office that is not supportive or will not co-sponsor ELSA. We will never get 100% of everybody on board, even though we would love that. There are very few bills that ever garner 100% support, and that's okay, especially health insurance bills. There are some offices who just do not sign on to health insurance bills, and that's okay. Don't argue or engage in political bickering. There are some offices who just do not like healthcare bills, and they may want to engage in arguing, but that's not what we're there for. Just try to pivot the conversation and explain why you're there and why you're advocating for ELSA. If they are opposed to ELSA, thank them for clarifying their stance. Ask them exactly why they don't support ELSA, and ask them if there's anything that can be done to garner their support. Take notes and then enter them in the mobile tool. We'll follow up with them afterwards. And I have to say there are several advocates who have come to me afterwards and said, this advocate will never sign on. And just to quickly mention, some of those, or this member of Congress will never sign on. And some of those members actually have surprised us and signed on after we explained all the intricacies of the bill. So don't give up and don't feel bad. If applicable, use the talking points and the information that are in the soapbox tool and address their concerns. But then again, if somebody mentions a CBO score or any of the intricacies of the bill, just let them know that you'll follow up with them or a member of the advocacy committee. And then also stay in touch with the office and share updates on the bill. Either you or your family members can do that. So one of the things I wanted to mention is that in the past, we've heard a lot about the scope of ELSA. Several Republican offices have mentioned that they thought ELSA was too broad. Basically, in the 118th Congress, our bill leads worked with the committees of jurisdiction and legislative council to narrow the scope of ELSA. For anybody who's new, the bill ELSA used to cover all congenital anomalies. Now the bill has been narrowed in scope in the 119th Congress to address these concerns, and the bill is more craniofacial in scope. So if there are any offices who bring this up and just say, we don't agree that all congenital anomalies should be covered, you can now say this bill has been narrowed. It is now craniofacial in scope. And 100% of the meetings that I've been in that I've mentioned this, the offices were happy with that change, and most of them were willing to sign on. One thing that you will probably run into in one of your meetings is offices will ask if ELSA has a cost estimate, which is also called a CBO score. And many offices will say, oh, I'm sorry, we can't sign on to ELSA because it seems like it would cost a lot of money. So in the past, the Congressional Budget Office provided a score of $2.5 billion for ELSA, which would be over the course of year 2022 to 2023 for a previous version, basically because it would reduce tax revenue. However, the CBO did not take into, it does not dynamically score bills, so it didn't take into account the savings, and it would not take into consideration the eliminated secondary health treatments that are being paid for by insurance. So even with the secondary savings omitted by CBO, the report still found that insurance premiums would rise less than 0.1% to implement ELSA's requirements. Even more fundamentally, families are already paying for these coverages. Most private health plans provide coverage for congenital anomalies, and all states require insurers to provide coverages for congenital anomalies. Therefore, of course, ELSA seeks to ensure health plans do not bypass necessary coverages by using loopholes or unintended coverages. One thing I was going to mention is that now that the bill is narrowed, a new CBO score has been initiated, and we're hoping that that score will go down quite a bit. So any of the offices that had any issues with the CBO score should be happy to hear that the bill was narrowed somewhat, so that the score will hopefully go down. And again, you don't have to know any of this. I'm just letting you know a couple of the things that you may run into while you're on the Hill. And again, if you don't feel comfortable sharing any of this information, that's okay. I can follow up with those offices afterwards. So there are some offices who are going to ask you exactly why is a federal law required? Why aren't private health insurance plans who are already regulated by the states, why aren't they using state statutes? So in all 50 states require some type of level of coverage for the treatment of congenital anomalies or craniofacial anomalies. These laws vary in their requirements. Some are very extensive, and then others are more limiting. However, regardless of our families continue to experience insurance denials and delays, and that's because over 2/3 of Americans have self-funded plans or ERISA plans, and those plans are not state regulated, they're federally regulated. And more Americans are now getting self-funded plans because the insurance companies do not have to abide by the state statutes. So this is exactly why ELSA is important. Basically, what it would do is ELSA would provide a floor to ensure minimum coverage by private group and insurance health plans, including those self-paid plans. As more and more people are on self-paid plans, we will need a federal law. Very rarely do I ever hear of families who are able to use the state statutes because these plans are federally regulated. And again, you don't need to know this, but I can always follow up with offices if they bring this up in your meetings. So after Hill Day, building relationships is one of the most important things that you can do. You need to have meeting follow-up. So immediately after, please complete the survey in the Soapbox tool. Within 24 hours, please email the staff and thank them. Even if it's just one line, thank you so much for meeting with us. We are so thankful you took the time to meet, and we are happy to be a resource. That's all you need to send. Follow-up is just as important as your legislative meetings. I'm hoping all of you build relationships with your legislative staff. They're amazing people. They're very well versed in legislation. And I truly hope that you will find a connection with them one way or another. Send additional information and pictures as applicable. If you don't hear back, email, call the DC offices every 1 to 2 weeks. Please be kind and patient and ask how their review of ELSA is going. Again, build those relationships. Be persistent, positive, patient, and passionate. Kindness makes all the difference. Don't argue. Make sure you educate. Let the offices know you are looking forward to hearing back from them and that you'll be a resource. Share updates on ELSA. I reach out to my legislators and I just let them know we reached this milestone. We're almost to 100 co-sponsors in the House, or we're almost to 30 in the Senate. Is there anything I can do to get my senator to sign on to this bill? There's thousands of pieces of legislation introduced every year. Explain why ELSA should be a priority to your legislators, and then also make sure you tag your legislators in social media posts. So this is something I always like to mention. It's the 80-20 rule, and we need to stand together behind it. So Senator Enzi, who was an amazing senator, now retired, a Republican from Wyoming, had an 80-20 rule that many members of Congress live by. And it's basically saying that legislators can agree on 80% of issues and work together to find a consensus on bipartisan supported legislation, and they can leave the arguments of the other 20% for another day. This rule is a philosophy that it allows bills to move through Congress, just like ELSA. ELSA has been one of the strongest bipartisan supported healthcare bills in the past. As a matter of fact, it was in, I think, the top 3 most supported bills in the 117th Congress. We are asking that offices put aside their differences and stand together to find a way to move ELSA forward. Our advocates have been sharing their stories for almost a decade, and ultimately, the message we need to get across to all of our members of Congress when we're on the Hill is it's time to pass ELSA. And now we're going to have a brief youth advocacy training from my son, who's going to introduce himself quickly. And then we will finish up and I will go through all of the questions right after Ryder is done. So here you go, Ryder.
Hi, I'm Ryder Abbott. I'm a youth advocate. Ensuring Lasting Smiles Act. What is Ensuring Lasting Smiles Act? Is a bill that one day is one bill that will one day become law in the United States. This bill is inspired by my brother Aiden and will help advocates and others who are born with congenital anomalies get treatments they need for their teeth, eyes, ears, and other parts of the body. It is not like Elsa from Disney. What does it mean to advocate? Advocacy is sharing your story or your family's story. When you share your story, it helps educate lawmakers on how they can help you and your family. What's your story? Who can advocate on Capitol Hill? Anyone can advocate on Capitol Hill. You can be any age. You do not need to have a congenital anomaly. I advocate for my brother, my older brother, and everyone who would benefit from ELSA. If you do not have a story of your own, you can advocate for your family or a family member or a friend. Who can I meet with on Capitol Hill? You can meet with the people who make laws. They are called legislators, and they are from your state. Advocates will meet with 2 senators and 1 representative and or their staff from your state. Why are we sharing our stories? We're asking our legislators to support the Ensuring Lasting Smiles Act, is also called ELSA. Each person who shares their story is helping the congenital anomalies community. If you are here with your family and not effective, does your story matter? Yes, every story matters. Legislators want to know why you are advocating for ELSA and why you want them to pass ELSA into law. We're working as a team to help one another. What if I'm nervous? Write down a story on your paper or note cards to read off of the notes. Your legislators will understand. I have apraxia and I just graduated after 7 years. I get very nervous and always have to read off of notes to remember what to say. What should I include in my story? Be honest and speak from your heart. Tell legislators how you feel and how passing this bill would make a difference for you and your family. Share whatever you feel you're comfortable with. You'll do great. Don't forget to take pictures and have fun.
Thank you so much, Ryder. I appreciate that. So now we'll talk about social media advocacy. I have to mention that social media advocacy is one of the most powerful ways, not only to garner support for ELSA, but also to raise awareness for ELSA and get your colleagues, your family, your friends to also advocate for ELSA. So offices have many different variations of their titles. So for this one, this is Senator Bill Cassidy. He has U.S. Senator Bill Cassidy. Sometimes they have Senator Bill Cassidy. Sometimes they have Senator Cassidy. But we do have a list of all of the different tags for legislators on our advocacy resources page. So I would really encourage you to read that list and find them because sometimes they're a little bit hard to find. Please try to use the Ensuring Lasting Smiles. That's Ensuring Lasting Smiles without the act. After it, that's the official hashtag of the Ensuring Lasting Smiles Act, as well as NFED on the Hill. Please take your legislators and either include a picture or use our ELSA sign, which is also on our advocacy resources page. You can create your own post or reply to your legislators' posts and tag them in the comments section. Always remember to be kind. I have had advocates in the past who have commented on a post, made a very nasty comment, and then right afterwards ask that legislator to co-sponsor ELSA. We do not want to do that. We want to stay positive throughout. Try to, even though it's very hard, leave your bias at the door and truly just be kind. We need every member of Congress to support ELSA. Don't be afraid to ask for support from your family and friends. Encourage them to repost your information and tag those legislators. And truly together, we can amplify our voices and make a greater impact. We will have a social media guidelines in your packet. And truly, we try to create a safe space for everybody who attend. Therefore, truly to protect the privacy of affected individuals and families who attend the event, we don't allow anybody to take video in any of the sessions. But if you do have pictures that you take of other advocates and people who are affected in your group, please ask them before you post on social media. There are just some advocates who do not want to be on social media, and that is perfectly fine. We want to respect everybody's boundaries, so just please ask the office that you're with if you can post a picture, as well as anybody who is in your group. So of course, we are here to answer any questions. Here's my email address. Also, Kevin, who is our Family Advocacy Committee co-chair, this is his email address. Please feel free to reach out at any time with any questions. And then, of course, last but not least, I want to thank all of these wonderful families and organizations. We are a very small organization, and it takes a huge team to be able to pull this off. If you're having dinner, make sure to stop by and say thank you to one of the colleagues or members of Smile Train. With all of the changes on the Hill, we had to change our location. It was a lot more expensive, and they've generously covered the cost of the meal for everybody. We're so thankful to Operation Smile, as well as the American Academy of Pediatric Dentistry. We are so thankful to all of the family donors as well. It's truly amazing to have everybody who donated to our Amazon wish list. Every single donation has helped us be able to have this event. I also wanted to thank the staff at NFED. They do an incredible job of pulling off this event. I know Kayla and Andy, I'm just going to give a real quick shout out. Kayla takes care of all the registration. She does all of the work in the background to make sure everything runs smoothly. Every time somebody registers late or needs a change in t-shirt size, she's always happy with a smile on her face to do everything. She's in the background here doing the slides and entering everything in the chat. So give a huge shout out to Kayla. I truly appreciate her. Andy has worked on so much in Marcom. I'm not sure if she's here tonight, but she's done, anything from sending out emails to helping with the PowerPoint to sending out information to our advocates. So I'm just really, truly grateful for the NFED staff who support all of the advocacy so our advocates can be in DC and share their stories. So with that, I am now going to switch over to questions and answer those, as many as I possibly can in a short amount of time. So the first one is, can we ask Congress people that are already co-sponsors to reach out to other representatives in their state to sign on? Absolutely. So that would be considered reaching out to other members of the state delegation. So I'm in Wisconsin. I would ask Senator Baldwin. Senator Baldwin I would love to have you reach out to the other members of the Wisconsin delegation and ask them to co-sponsor, because you're already a co-sponsor. She's actually a bill lead, but I'm just giving you that as an example. It's a great way to get additional co-sponsors. So yes, I would encourage you to do that. There's a question. Why didn't ELSA pass in the 117th Congress with 310 representatives and 61 senators? It was only because of time. There wasn't enough time to get, after the bill passed in the 117th Congress House, there wasn't enough time to make it through the Help Committee and to get it to a vote. We were so close. If we had probably another month, we would have made it through. We just didn't have enough time to make it through committee and to a vote. Can you give a brief overview of the loopholes that insurance used to avoid covering treatments? Sure, I can just give you a couple of them. One is that insurers will say this is not medically necessary. So then you go back and you get letters of medical necessity. With that, then they have to find another loophole. So they say, okay, it's medically necessary, but this is dental. We don't cover dental treatments. And it's just a never-ending chaotic cycle of them trying to find loopholes to deny or delay up until you've run out of all of the denial and appeals process. And then at some point, it just stops. Let's see. Can we send you photos if we don't want to post on our personal accounts so you can post? Yes, so we are actually going to have a Google folder available on Hill Day. It will be right on the top of your digital schedule, and you can just click into that link and you can actually just download any photos or videos you take, and then we will be reposting those throughout the day. I think that's all the Q&A. Let's go over to the chat. Kayla, if you see any that I missed, just let me know. Becky, should we include bio information in our one-pager, name, address, congressional district? You can if you want to. You don't have to. It's a great way to follow up afterwards. If you don't have enough room, you don't have to. The offices will have your name, address, your district, because you registered, and all that information has to go to the offices in order to be added to the schedule. Karen, will we want to wear our Elsa t-shirts on Tuesday? Yes. If you would like to put them on for the walk, you're more than welcome to. It would be great. But yes, please wear your t-shirts on Tuesday on the Hill so we can raise awareness for Elsa. Lucy, will we have one leave behind folder for each legislator that the meeting lead will present to them? Yes, we will provide you with a folder. We'll have the one pager in there, and then also you will add all of the different personal stories into that folder, and then the meeting lead will present that to the staff. Should we bring copies of the one pager? No, we will provide those for you so you do not have to print those off. Yes, the example of the one pager is on our advocacy resources page. Kayla posted that. I would not start with mentioning that the bill was narrowed. You can mention it. I wouldn't start the meeting off by that. But you can mention it in there just to say the bill used to cover all congenital anomalies. Now it's craniofacial in scope. Craig asked about Medicaid and Medicare. Medicaid and Medicare, as well as government plans and military plans, are not covered in ELSA. The first portion of ELSA will only cover private, group, and individual insurance plans, and we're trying to get that portion covered first. But of course, we hope that once that is done and implemented, that the other all the other government plans will then follow suit. And that's what usually happens. Can we get an existing list of members that have supported and opposed? So there will be several different links in your online schedules. One of them will be the existing members that are currently co-sponsors. There will be a list of the co-sponsors in the 117th Congress, and then there will also be a list of the members who voted yes or no in the 117th Congress in the House. And that will all be on your digital schedule. Yes, Karen, you can also wear the t-shirts to the walk on Monday evening. If we take photos with our staffers, should we share those with you? Yes, please download those into the Dropbox that will be on your schedules. Craig, I kind of mentioned this before, but we just ran out of time in the 117th Congress to get ELSA passed through the Senate. In the 118th Congress, which ended last year, it was what I consider our limbo year. We just really talked to all of the offices, found out exactly why they were concerned, what they were concerned about, and that's why the bill was narrowed in scope. So we really just took that time to make sure that we listened to everybody and took everybody's thoughts into consideration. For locals not staying at the hotel, should we meet at the ADA house at 7:50 or go right to the first meeting? It's whatever you feel more comfortable with. You're more than welcome to meet the advocates at the ADA townhouse or go to your first meeting, whatever you feel more comfortable with. Some people like to meet at the 88 townhouse only because they want to go with the group the whole time and meet up with that group, but feel free to do whatever makes you more comfortable. Can we just put a small sticker on the badge of those who don't want to be tagged on social media? I'm not sure what you're asking there. I can follow up with that later. I'll type ones, I know. So in terms of, there's a question here about keeping ELSA fresh. There are so many new members of Congress, number one, that have never heard about ELSA. So many of the members that you'll be meeting with or their offices have not heard about ELSA before or do not know the history of ELSA. Two, there's been so much going on the Hill that many of the offices have not been focusing on ELSA. So whatever you share with them at this point is going to be fresh in their minds. There's just so much going on that we just truly need to keep ELSA in whatever way you bring it up in the forefront of everybody's minds on the Hill. So you don't have to really worry about making it fresh. I would just truly educate them. That's the most important thing that you need to do right now. Brandy, you just made me laugh. I have to mention that. If we include pictures with our one-pager story, do we leave the pictures or just share in the meetings? What I usually do is I just put the pictures actually on the one-pager, just copy and paste them on there so you don't have to leave pictures, but you're more than welcome to leave pictures behind. It's really whatever you're most comfortable with and what's easiest for you. And then there was a question about what were their concerns. So one of the concerns is what I mentioned in my slides, the CBO score. I wouldn't bring up the CBO score. I wouldn't add that to your letter. If it comes up in an office, if you feel that you have enough information, you can talk about CBO score. I wouldn't bring it up in a letter though. One question or one concern is about, of course, the scope of ELSA, that it would cover all congenital anomalies, which would then lead to possible physician misuse and possible higher CBO score. Again, I wouldn't address any concerns in your one pager. If it's brought up, you can address it. But from what I've seen on the Hill this year, there really hasn't been very many concerns whatsoever. Again, there's offices who will not sign on to healthcare bills. There are offices who will not sign on to bills that have a CBO score. And there are some offices who just feel that government shouldn't be involved in regulating healthcare, so they won't sign on. So this year has been kind of an anomaly that we really haven't had too many offices who have been concerned about anything now that the bill is narrowed. So hopefully it'll stay that way. Rebecca mentioned, does Ryder have a list of offices that have candy stashes asking for Mason? Yes, we have a whole list of offices that have wonderful snacks. Just to quickly mention, many of the Senate offices have snacks in their offices that have a theme from their state. So for example, Wisconsin has craisins and chips. If you go to Pennsylvania, they have chocolate from Hershey's. So feel free when you walk into the office, if they have snacks, ask for snacks and they're happy to provide those to you. Idaho is a big favorite of ours. They have potato chips. Michigan has soda and cereal. So feel free to ask for those snacks as soon as you get there. I think I covered all of the questions. Does anybody else have any other questions before we wrap this up? Just going through this real quick. When we are at dinner, just know that I will be going through a very short version of some of this. I'm hoping to have a mock legislative meeting as well. So if you would like to watch that, just so that you get an idea of what it'll be like on the Hill, that would be great. Just trying to think of any last minute things that I'm missing here. If there aren't any other questions, feel free to reach out. No food in our bags. Yes, you can bring packaged snacks. We'll be providing packaged snacks. You can go ahead and put those in your bags. As long as you're not going into the actual Capitol building, they shouldn't ask you to throw those away. But yes, I would actually bring snacks along just in case the cafeterias are closed. Randy, yes, crying is okay. Smile, have fun. It isn't as nerve-wracking as you think it's going to be. Truly, I enjoy every meeting I have with advocates. We all try to uplift and empower each other. And just, I understand it's a stressful time on the Hill and there's a lot going on. But truly, go there and have fun. And remember, I mean, I'm not trying to make it sound too heavy, but we're going there to truly change the world and change the lives of so many who have been waiting for these treatments. And I know that that sounds like a big lift, but we should be happy and joyous as we go there to share our stories. It's a privilege to be able to go and share your stories with members of Congress. So with that, if there are no other questions, reach out to me anytime from now until Hill Day. I can't wait to see you all. It's going to be amazing. We're going to have a great day, even with the government shutdown. I'm so excited to walk the halls of Congress with all of you. So have a wonderful night. Write your stories. If you need help reviewing those, please let me know. But other than that, I look forward to seeing you all next week.